Welcome to our last lesson in the integumentary system. This one we're going to focus on the pathology of the skin. So by the end of this, you should be able to describe the specialists that treat disorders related to the integumentary system, as well as the common disorders and conditions that we see related to the integumentary system. So let's start with the medical specialties. Two medical specialties I want to point out here are a dermatologist and a reconstructive surgeon. Now, dermatologist, dermat means skin, ologist, the person who specializes in it, and they specialize in diagnosing and treating disorders of the skin. Makes sense? The other one is reconstructive surgeon. To reconstruct, to rebuild. These are people who specialize in restoring the body back to as normal look as possible. You may also have heard them called plastic surgeons. And remember that term plastic has surgical repair. Now, when we think of a reconstructive surgeon, I primarily am thinking of people who've had injuries, disfigurements, and those kind of things that need to be repaired. When you hear the term cosmetic surgeon, they're doing procedures that are there to improve appearance, but they're not necessarily medically necessary. So if you hear that term cosmetic surgeon, it's usually the non-medically necessary surgeries, but reconstructive is those that are medically necessary. So let's start with problems with sebaceous glands. Now, sebaceous glands excrete what? Okay, they make sebum. Okay, that oil. So these are the oil glands. The first one I'm going to discuss here is acne vulgaris. And that's the picture that we have over here on the left-hand side of the screen. And acne vulgaris is a chronic inflammation. And it's a chronic inflammation that causes these bumps that are filled with sebum. Okay, in other words, the person's overproducing sebum and it causes inflammation around each of the hair shafts. So this is a condition that's treated by a dermatologist, anti-inflammatories, sometimes antibiotics, and things that will help keep the pores open and help decrease that buildup of sebum. Now, the second thing on here is a comedo. Now, a comedo is a non-infected lesion composed of sebum, and it's located in the hair follicle. So the common terms that you would know these as would be a white head and a black head. And in this picture here, you're seeing some of these, what we call white heads. And a white head is one in which the sebum builds up, but the skin has grown over it, so it appears white. In the event that it is the area is open to the air, it turns black because when the air hits the sebum, it oxidizes and causes that blackish color. So both of them are the non-infectious. You've probably seen them on yourself, a white head and a black head, and the medical term for those is comedos. So things that go on with the hair. The first one that we're going to look at is folliculitis. Now, folliculitis is, if you break it down, itis, inflammation. Folliculo refers to the follicles. Okay, so you get inflammation around that hair follicle. The hair follicle gets red, it gets bumped, it gets sore. Okay, and again, we would treat this. We would look at the underlying cause of what's causing the inflammation and then treat the cause. Is it an infection? Is it an irritation? What's causing it? Another disorder of the skin is hirsutism. Hirsute refers to hair or being hairy. Ism is that condition. This is excessive hair. In fact, excessive body hair. In women particularly, you would see beards, you would see the hairy backs and things like that that you see in men. Men can also get hirsutism. These are the people that I described that the guys look like they're wearing a sweater even when their shirt is off. Okay. Um, so that's excessive body hair. It's usually hormonal related, and sometimes balancing hormones will help with this in addition to hair removal procedures. The last one is alopecia. Alopecia refers to baldness, um, partial or complete loss of the hair. One of the times we see this is, for example, people are getting chemotherapy medications. Chemotherapy causes the hair cells to die, and as a result, the person may end up with partial or complete loss of hair on the body and the head. Things that can go wrong with the nails. In this picture, what you are seeing is something called clubbing. And I want you to take and notice when you look at this, you can see the fingernail kind of comes down and curves over the end of the finger. It's not flat and straight. This is abnormal. And it's usually also accompanied, and you can kind of see this by a widening of the fingertips too. So instead of the fingers coming narrower, they actually get wider at the end. Now, this can be something that's hereditary that someone just has genetically in their family, but more often than not, it's due to a respiratory problem. It's a problem of not getting enough oxygen to the extremities, to the fingertips. So when you see this, you're usually looking at someone who may have an emphysema, a COPD, something like that, where they have a chronic issue with getting in enough oxygen. We also see like the nail color, the nail bed color underneath is not nice and bright and pink either, like it should be. Onychomycosis. That's a mouthful to say. Onychomycosis. Onycho refers to the nail. Myc is fungus. Osis, condition of. Onychomycosis is a fungal infection of the nail. And when you're looking at this picture right here, you can see that this person has this yellowish area underneath the fingernail hairs, and that is typical of a fungal infection underneath the nails. Now, where do we see a lot of this lately? Well, we see a lot of it with artificial nails. Uh, Having artificial nails, if can allow fungus to get trapped underneath them. And then when it does, you can end up with onychomycosis, a fungal condition of the nails. The treatment for this is, there are oral antifungals people can take, but even though you treat the infection, it'll take as long as it takes for the nail to grow out, to get rid of the look of it. So it can take months to get rid of a fungal infection, the appearance of a fungal infection under the nail, because that whole section has to grow out. So let's talk about some bleeding, and particularly bleeding into the skin. Remember, blood belongs in the blood vessels. It doesn't belong in organs in the skin and other parts of the body. So as a result, the body is not happy, or I should say the integumentary system is not happy when it gets blood in it. So let's look at some of these terms that have to do with blood in the skin. So the first one we're looking at is contusion. A contusion, another word for that is a bruise. And contuse or contuss means bruise. It's a condition of a bruise. Okay, so we've probably all had this and experienced this. You bump something, you walk into the corner of the coffee table, for example. I'm good at doing that one. And you end up getting a bruise underneath the skin. So that is what we would call a contusion. It is flat, it is not raised. It'll start out usually initially immediately red, and then it goes to that purplish color, and then as the body breaks down the blood cells, it goes to that greenish and yellowish and eventually disappears. The second term, ecchymosis. Ecchem, believe it or not, means pouring out of juice. Okay, osis is a condition of. Ecchymosis is really large, irregular areas of discoloration under the skin. It's black, or I'm sorry, it's flat. So it is flat like a bruise, but if we had ecchymosis here, it would be like much larger and kind of irregular shaped. It wouldn't be like that nice round shape. We often see this in people who are taking medications that decrease blood clotting. So people who are on what you might call blood thinner, um, anti-clotting agents. We often will see these in that they get these areas of bleeding underneath the skin. You also see it a lot in our elderly population as they go and they also lose the connective tissue, that adipose tissue underneath the skin in that subcutaneous layer. It gets smaller, it gets narrower, and then as a result, the blood vessels can leak out into the skin. And then the last one on this page with dealing with bleeding into the skin is a hematoma. Now, if you've noticed, we've moved from small to bigger to biggest, basically. Hemat, blood. Oma is a tumor. This is like a large bump. It is no longer flat. It is a raised area that is due to the swelling and clotted blood underneath the skin. So this is like the kid who falls off their bunk bed and hits their head and immediately gets this huge bump on their head, on their skull, on their cranium, and these will take quite a while to go away. Can also sometimes we see these do with after surgery. Patients will get hematomas around their incisions. Again, a large a vessel that didn't close immediately after surgery that ends up bleeding into the skin, and you get a large amount of blood under the skin, and you can get these bumps. They are sore because, again, the body doesn't like blood in areas it's not supposed to be in. In addition, we have to watch these because they are so large and they take a long time for the body to break them down. We have to watch them for infection. These can develop infections. Okay, so lesions, things that occur on the surface of the skin. So we're talking about stuff on top of the skin. So the first thing would be a crust. And a crust is that serum, that yellowish dried up stuff that'll occur on top of the skin. So it's really serum and stuff from like skin cells and things like that that accumulate on the skin. And it is, again, it is not bloody. It is generally clear. A macule is a flat discolored spot It's less than a centimeter. A common term for this would be a freckle. Okay, so it's a spot, it's flat. A freckle would be an example of a macule. It could be a red spot too, but it's small, less than the size of a pencil head, or I should say a pencil eraser. Verruca. Now, verruca, I remember this because if anybody has watched the movie Willy Wonka and the Chocolate Factory or Charlie and the Chocolate Factory, the one little girl's name is Verruca. Verruca is a name for a wart, okay, commonly caused by the human papilloma virus. So these are warts, they are bumps, they are kind of cauliflower-like looking that can occur literally anywhere on the skin, and it's due to a viral infection in the skin. Um, they can be removed. They can be treated often like with cryo, with a freezing procedure to get rid of them. But remember, it is a virus, so they can come back. And the last term is a wheal. A wheal is an itchy bump. It's usually red. It's a red itchy bump, kind of raised, and it's usually due to an allergic reaction. So this would be the type of thing you would see if someone had developed hives. So now we're going to talk about lesions, but specifically we're going to talk about lesions that have fluid in them. So these are bumps that you'll see on the skin, but when you would open them, what we call incision and drainage, fluid would come out of them or something comes out of them. So the first we're going to talk about is an abscess. And an abscess is a pocket in the skin that contains pus. It's usually due to bacteria getting in there and growing. And then, of course, the pus comes to try to kill the bacteria. These will continue to grow until they are treated. So they can go from anything that's small, about the size of a pencil head eraser, to very large areas. As they get large, people will often then start to get a fever and pain and that along with them, because the bacteria then can travel and get into the bloodstream too. So they do need to be treated with antibiotics to clear them up. I'm going to skip a cyst for now and come on to pustule. A pustule is a small area, red bump that contains pus. Now, unlike an abscess, these are small, they are self-contained, they don't spread and get bigger. The best way I can describe one of these is picture a zit. A zit is an excellent example of a pustule. And then the last one I want to talk about is a cyst. Now, a cyst is an abnormal sac that contains fluid or semi-solid stuff. And I have a video here that I'm going to have you watch that depicts a cyst being taken care of by Dr. Pimple Popper. I think it's a very good example of what a cyst looks like.
All right. Eric is here today. He has a bump on his scalp that I think is a pilar cyst. He does tell me that there's been trauma to the area, so that does make me wonder maybe it's a lipoma. We're only going to figure this out once I start removing it. Watch out. It might be a little bit under tension, just to warn you. Come to mama. Oh!
Oh, good Lord.
On my arm.
Oh, my God, I'm sorry.
It's okay. But I have to stop for a minute to take the acid off my arm.
Oh, jeez.
It missed your scrubs? Yeah, it did. Pilar cysts are probably the type of cysts that get me the most, and that's because it has a thicker walled sac, and it's particularly satisfying to squeeze it and get it out whole, but sometimes I get a little too aggressive and squeeze too hard, and then it pops. I'm giving everybody hugs after this.
You're welcome, I suppose.
I don't commonly get it on my arm like that.
Yeah. What kind of distance are we talking here?
Had a good trajectory. Had some good projection.
Nice arc.
Yes, there was definitely an arc. So much for splash guards, but my most important goal here right now is to remove the sac completely so that this cyst does not come back.
So just to reinforce what Dr. Pimple Popper said there, she does have to remove that sac because with the cyst, if you do not remove the sac, it can fill up and come back again. So now some invasive lesions, some things that go down into the skin. Up to this point, we've kind of been on top of the skin, and now we're getting down into the skin layers a little bit more. First, an abrasion. An abrasion is a scrape. Okay, you know, you rub up against something, you scrape the top layer of the skin away. A fissure is a crack. So it's a crack that occurs in the skin. Often in the winter times, we'll see these like in hands and knuckles and things like that. Skin gets dry and it cracks. A laceration. A laceration is a tear in the skin. It's a wound in the skin. It's jagged, it's torn, it doesn't have nice straight edges. And then the last one on here is a pressure sore. And a pressure sore is an ulcer that occurs from the skin wearing away. It comes from friction. We see these in long-term care facilities. We see these at home in elderly patients who are bedridden, who cannot get up and move. So that's why we have to change their positions frequently so that we cut down the amount of friction on the skin and decrease the chances of pressure sores occurring. Dermatitis. Dermat, skin, itis, inflammation. It's an inflammation of the skin. Okay, and I'm going to give you two examples on here of dermatitises. One is contact dermatitis, and it's just what it sounds like. Contact. You come in contact with something and the skin gets inflamed. For example, in this picture, this person obviously had a ring on that caused a contact dermatitis. Now, one of the things you often see along with dermatitis is a symptom of pruritus. Pruritus is itching. So that's the fancy medical word for itching. So dermatitis, you're going to see redness, you're going to see itching, and you treat it by getting rid of the allergen, whatever the person was allergic to. The other type of dermatitis we're going to talk about is eczema. Eczema is a chronic type of dermatitis. It reoccurs. You get that redness, that itching, that pruritus, that dryness in the skin. We often think this is an autoimmune issue. We also see it triggered with stress, but it's not due to an allergy. Psoriasis. Psoriasis are these red areas that happen on the skin. They can be kind of raised, but they also get these scales. They get these whitish kind of silvery scales of dry, thick skin. So the skin kind of gets, like I said, it gets thick, it gets rough. And we've been seeing actually recently a lot of commercials for medications to treat psoriasis on television. Psoriasis, again, is thought to be an autoimmune disorder whereby the body's own immune system is attacking the cells and causing it. So the medications that we often treat this with suppress the immune system. Okay, so the next couple disorders we're going to talk about are caused by bacteria. So these are bacterial skin infections. So these are infections that occur in the skin caused by a bacterium getting in there. The first one, and that's our picture here of the toe, is gangrene. What happens with gangrene is the tissue dies, okay? For some reason, maybe a lack of blood supply to the area, the tissue dies and then bacteria get in. The concern with this is the bacteria, if it's not treated, can then get into the bloodstream, and now you can have a major infection going on in the entire body. The treatment: remove the area. So in this case, we would take off that toe and give antibiotics. Impetigo. Impetigo, we see this in kids. It's very highly contagious bacterial infection. And it gets these kind of yellowish crusts. This is a great example of what a crust looks like. Often see it on the faces and hands because what do kids touch all the time? Their faces. In particular, look, it's the nose. You know, kids and fingers and noses are just, it's an automatic association. The key to this is hand washing, keeping hands away from the face. Once they get it, they're treated with antibiotics and isolated from other children until they are no longer infectious, because it quickly passes from one child to the next. And the last one here is cellulitis. Cellulitis is when bacteria gets into the connective tissue in the skin, so that subcutaneous layer of the skin. And this area that's outlined here is a cellulitis that has occurred in this leg. You'll see swelling. Person will get fever. It'll be warm. It'll be red. And like I says, marked swelling goes along with this. Again, if it's not treated, it can open up and can start to weep. And now you're also dealing with the issue of now you've got a wound to heal and you've got further risk of more infection occurring. So again, treat it with antibiotics. Fungal infection of the skin. If you've seen this or heard of this, this is ringworm, and this is a classic ringworm picture. Ringworm is not caused by a worm. It's caused by a fungus. We think it's called ringworm because it gets this ring shape. The classic is it's a ring shape, but then the center will be very light in color. It's a fungal infection. Fungus can live on surfaces. And so this is one we often would see in cheerleaders and wrestlers, gymnasts, anybody who's down on the mats. If someone brings the fungus in and it gets into the mats and then someone else gets on the mats, they pick the fungus up and it just perpetuates itself. The medical term for ringworm is tinea. So tinea is ringworm, a fungal infection that occurs in the skin. Parasitic infections. Okay, what's a parasite? Okay, it's something that has to live off of something else. So these are live organisms that are living off of the body. Two of them, pediculosis, and pediculosis is the medical term for lice. And in this picture, this is what you're seeing. These are what they call little nits. Okay, the eggs. What happens is the lice, lay their eggs on the hair shafts, and they stick to the hair shafts. Special shampoos and combs and that to treat these, as well as disinfecting anywhere where the hair has been to kill off any of the lice that are living on things like bedding, on stuffed animals, on beanbag chairs, things like that. Scabies. Scabies is a parasitic infection that occurs under skin by itch mites. And what happens is these little mites burrow under the skin. and they cause these itchy red areas here. And again, you have to get rid of the mites to get rid of the infection. Okay, I do want to take a little bit of time here in the lesson to talk about skin cancer. Skin cancer are malignant growths that occur in the skin. And there are 3 types of skin cancers: basal cells, squamous cells, and melanoma. And we're going to talk a little bit about each of these so you understand where it comes from. So basal cell, squamous cell describe the type of cell that it comes from, and so does melanoma. Carcinoma, cancerous tumor. So a basal cell carcinoma originates in the basal cell layer of the epidermis. So that's the layer of the epidermis that generates the new skin cells. So here's a typical look of a basal cell carcinoma. Okay, the nice thing about these is that they rarely spread. So they can be taken off, removed, or cryo-freezed, and they don't come back and they don't spread to other areas of the body. Squamous cell, okay, squamous cell happens in the squamous layer of the epithelium, okay? So again, it's just another layer of cells in that top layer of the skin. The difference between these and the basals, these can spread more quickly to other areas of the body. And so again, these have to be watched. They would get removed and then the area around it would have to get treated very well, and we would have to watch this person to make sure it didn't show up in other areas of the body, which is called metastasis. And the last one is a malignant melanoma. This is probably the most serious of all the skin cancers. Melan is black, if you remember. The term actually means black. And what happens is this is a cancer that occurs in the melanocytes, the cells that make the pigment melanin in the skin. Initially, the symptoms tend to be that you see a change in size, a change in shape, or the color of a macule or a freckle or a mole that was there. If you're looking at this picture and you notice the name, this is me. And this right here is a malignant melanoma on my leg that was surgically removed and reconstruction done. So this is actually my melanoma. The things when you're looking for skin cancer, the things that we tell people to watch out for are to remember the ABCDEs. So 5 things. Asymmetry. Is it a round, perfectly round shape, or does it have unusual borders? Borders are irregular. Okay, so now those borders are jagged. It's an unusual shape. It's not perfectly round, and the borders around it aren't nice and fine and refined. The colors in it are not uniform. There might be pink areas, white areas, black areas, and that it's not all one solid color like you see when you have a freckle. The diameter greater than a pencil eraser. So bigger than that head of a pencil eraser is a clue that could be cancerous. And the last one is E is evolving, that it's changing. And we mentioned that with the melanoma, that it over time you see it changing shape, changing color, changing size. So those are the ABCDEs to look out for with skin cancer. Okay, so practice makes permanent. See right now if you can just remember and write down 2 skin disorders and define them that we talked about. Use the review the lecture and use the other materials in the unit to go and practice until the pathology of the skin becomes permanent.